The situation constitutes a public health emergency of international concern.
A sharp rise in Mpox cases across multiple African nations has led the World Health Organization to declare a global health emergency. The outbreak, originating in the Democratic Republic of Congo, has now spread across neighbouring countries that were previously unaffected. The African CDC also declared Mpox a public health emergency. With over 15,600 infections and 537 deaths in the DRC this year, children have been particularly affected, raising significant concern.
This is not just an African issue. Mpox is a global threat, and it is in this moment of vulnerability that we must find our greatest strength.
What is Mpox? Mpox is a viral disease caused by the monkeypox virus, first identified in 1958 and endemic to Central and West Africa. It presents with a skin rash and flu-like symptoms such as fever, sore throat, and headaches. The rash progresses through various stages, leading to pustules that eventually dry and fall off. Transmission occurs through direct contact with infected persons or contaminated materials. Most people recover within 2 to 4 weeks, though the illness can be more severe in children, pregnant women, and immunocompromised individuals. While no specific treatment exists, symptoms are managed with pain relief and antibiotics, and antiviral drugs are being explored for severe cases.
In fact, if you look at the period, the most recent period, the number of cases in Africa is more than triple what it was when the peak was declared in 2022.
Why is this outbreak alarming? The outbreak is driven by a new variant, Clade 1b, which spreads more rapidly and includes transmission through sexual contact. WHO Director General Dr. Tedros Adhanom Ghebreyesus warns that this outbreak is more widespread than previous ones, moving beyond isolated family clusters and crossing borders at an alarming rate.
The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
What are the implications for Australia? Although no cases from this outbreak have been reported outside Africa, Australian health authorities are on high alert. Experts warn that as the virus evolves and becomes more transmissible, the risk of a pandemic grows. Mpox poses the greatest threat in regions with limited healthcare. But as the virus changes, every country faces potential risk. Vaccines are key to controlling Mpox, but access in Africa remains a major challenge. The African CDC reports only 200,000 doses are available, far short of the 10 million needed. To address this, the WHO has fast-tracked approval for 2 Mpox vaccines to improve access, especially in lower-income countries. Australia is closely monitoring the situation, and global cooperation will be crucial to controlling the outbreak, ensuring vaccine distribution, effective treatments, and strong public health measures.